Now at 6, while medical experts work to slow down COVID-19 in our communities, they're also working to stop the spread of misinformation. Doctors now worry that misinformation is keeping too many people from getting vaccinated. ABC 27 asked our viewers to share their hang-ups about getting the shot.
And ABC 27's Jada Williams joins us live tonight with medical experts' response to those hang-ups.
Yeah, well, there's no one reason why people don't want to get the COVID-19 vaccine, but now medical experts say that those various reasons why they're hesitant and the misinformation is starting to spread rapidly.
Still, we're in the home stretch, I think, of COVID here. I think, hopefully by this time next year we'll have things under control.
Doctors say the biggest issue standing in their way right now, misinformation surrounding COVID and its vaccine.
In this case, social media really has been extremely harmful in dealing with this virus, with the illness itself, and with the vaccine use.
So ABC 27 turned to you on social media to ask those who are skipping the shot what's stopping them from being vaccinated. For BJ, he says because he caught COVID, his antibodies should be enough. Doctors say that's not the case.
Vaccine antibodies are up to 10 times higher. So even if you've already had COVID, it's a great idea to get the vaccine just to be sure that you've got enough antibodies to protect you.
Mandy writes that she's worried about her pregnancy as well as the future of her fertility. Concerns also echoed by a student at Florida State University.
And that goes hand in hand with long-term effects is reproduction. If it affects male reproduction, female reproduction, and in kids, because this is all new, so people don't really know what's going to happen down the road.
But doctors say there's no evidence to back up those claims.
There's no biologic plausibility, which is a fancy way of saying, is there some logical way that this might connect to a woman's fertility chances? No, there's no logical, plausible way. It really is just a falsehood that's spread by social media.
And one of the biggest concerns raised, how quickly the vaccine received authorization from the Food and Drug Administration. Dr. Daniel Van Dermy says the process should be trusted.
People have said, oh, these vaccines are too new, and the technology has been around for many years. I mean, almost 10 years for the technology that is being used for the Pfizer and the Moderna vaccine. The technology being used for the other vaccines is even older than that.
The other reason Dr. Van Dermy says that it's okay to trust the length of time for the trials is because it was easier to find tens of thousands of people affected with COVID-19 as opposed to other illnesses where you can't find that many people. In Tallahassee, Jada Williams, ABC 27.